We're going to be working on nerve mobility of the nerve that branches out from the low back, goes down the back of the hip, through the hamstring, and down to 3 different nerves that go through the lower leg and into the foot. The way that we're going to improve mobility here is through what we call nerve flossing. So we're going to create tension all the way up through the spinal cord by moving from the hips and the back and all the way up to the neck. And we're going to create slack and tension and do the opposite with the leg here to create basically a movement through the nerve without increasing tension. So we're going to tension it through the leg, slacken it through the spine and move it down the chain. And then we're going to tension it up through the spine and slacken it down the chain just to move the nerve like this, maintaining the tension. If you do it too much in one of the areas, then it's going to pull on the nerve like this. And if your nerve is a little more sensitive, this can increase in symptoms. So when you're doing this, try to monitor afterwards, 6 hours afterwards, even up to 24 hours afterwards, because nerves can have a delayed effect in terms of their symptoms. And see, does it increase your symptoms when you do this exercise? If it is, you just go a little bit more gentle, and I'll show you how to modify that. So we're going to be trying to coordinate the head position, the spine position, and the leg position. So we're going to have you in this position here like this, starting with a slackened position here. So our foot here is kind of pushed forward like this because we have our leg back like this. So we're going to create tension through the spine by kind of flexing forward, flexing at the hip, creating tension here. Now, if you're here, we can modify how much tension by really going forward here. This is maximum tension, or if you're increasing symptoms with this exercise, you can modify this and then go less tension here. So this is the first position, and then the second position, we're stepping forward and extending like this. So now we're creating slack here, and we're creating tension around the foot and ankle. Then we're coming here, creating tension here, slackening there, and then up like this. So again, you can modify this. If you have good mobility in the nerve, you can really sink down here like this, and then move like this. Or if it's a little more sensitive, it can't handle that, then you just do a little movement like this and this.